Good Thursday afternoon, guys. My name is Jerry Miller, and welcome to the I Love CVille Show. Thank you kindly for joining us. We are live in Charlottesville, across Central Virginia, the Commonwealth, the country, and the world on the I Love CVille Network. Today's program, as promised, is going to be a dynamic one. Stakeholders in our community, folks with courage and experience on our panel today, and Dr. Eliza Holland and Dr. Jeff Vergales. We will welcome them to the program in T-minus 20 seconds. Some items before we welcome our guests. Yes, this is a question and answer format program. However, this topic undoubtedly a passionate and divisive one. If you'd like to participate with questions, please be mindful. We will only relay ones that come from a mindset of respect and a foundation of the golden rule. Lastly, before we start the discussion, I emphasize this throughout the week. We have a topic in masks in our school in a pandemic that is nearly 2 years old now that has undoubtedly divided this community. I want everyone to please realize and be empathetic to this fact. We're all, for the most part, on the same common ground of what we want from what's best for our kids, okay? One side is concerned about kids and socialization and returning things to normalcy, to have our kids have a childhood and an educational experience that we grew up with. That's coming from a good place. The other side is concerned about potential health and implications from this pandemic, and again, that's coming from the best for our children. So let's be empathetic about that, please. Judah Wickhauer is our director. Let's go to the three-shot. Let's welcome our panel, please, to the program. Dr. Eliza Holland, a pediatric hospitalist at UVA Children's Hospital, and Dr. Jeff Vergales, a pediatrician and pediatric cardiologist at UVA. Good afternoon, guys. Thank you for joining us.
Thank you so much. Thank you for having us.
Our pleasure. Ladies first. Dr. Holland, introduce yourself to everybody that's watching, and anything that we need to offer first before the discussion starts. Now is a good time to do it.
Great. Thank you so much for having me. My name is Eliza Holland. Apparently, I came with a frog. I do need to say up front that although I do work at the University of Virginia Children's Hospital, the ideas that I state are mine and not representative of UVA and the health system. That being said, I am a parent of two teenagers, and as soon as the lockdown started in March 2020, I was immediately concerned about the impact on my children as well as children across the country. We know school and socialization is an extremely important place and things for our children. I became pretty mouthy on the pediatric hospital medicine listserv about the risk of children being out of school. That summer, I helped with some COVID mitigation protocols at my daughter's summer camp. They were able to have a successful, although shortened, session. And I was able to be down there and help with that. And then coming back in the fall of 2020, I began writing to the school board and talking at school board meetings, and then helped my daughter's school with their reopening plan and helped them successfully reopen in January of 2021. So I have been working on all of those different fronts and very much believe that we need to prioritize our children and their overall well-being and their education. And so that's why I became involved with this project, The Urgency of Normal.
Dr. Jeff Vergales, the show is yours.
Jerry, thank you so much. So, as he said, my name is Jeff Vergales. I'm also a pediatrician and a pediatric cardiologist at UVA, and just also want to echo that these are my opinions and my opinions alone. You know, it's interesting. My background is in quality and patient safety, and I've been very privileged in a very, very nerdy way to run big databases for various patient and quality safety and pediatric cardiology for the last couple of years. And so that's kind of my scientific background that I brought. And, you know, so we've been dealing this with public health mitigation strategies, just very specifically in patients with congenital heart disease. You know, the pandemic hit us all, and we all had a very, very visceral reaction, you know, with a lot of things. A lot of it was fear, a lot of it was unknown. And I also have two children. They're a little bit younger than Liza's over here, but they, you know, we didn't exactly know what the future held for them. And that was a really, really important and really big distinction for what motivated me to kind of get more involved with this. And I kind of instantly switched a lot of things that were going on in my mindset with how could I help. And one of the first things that I realized I was able to do was to help with opening summer camps in child and congregate care settings. And so I went up to Maine. I took 4 weeks, focused time from work. I went up there. I worked with 6 other just dynamic pediatricians from around the country, working with the state up there specifically. And when we brought in kids from 47 countries, we brought in thousands of those kids from 47 different states and multiple countries at that point. And we were wildly successful. We published it with the CDC. We were able to do a lot of work that was really, really good. And we also got a lot of backlash at that time, and I think that's, one thing that kind of started to toughen me up about how we deal with this is that I was, oftentimes told that we were not going to be able to do this and that we were not looking out for the best interests of children. But I think Liza and I could very easily say that proved to be very, very different. When we were up there, the smiles on the kids' faces, the strategies we were able to do in order to bring them safely through an environment gave us a lot of tools for success in the future. When I got back, I got very ingrained with the Blue Ridge Health Department, and I have been cannot say enough good things about the Blue Ridge Health Department in our region and the people that work there. And they welcomed me with open arms, a little bit with the experience. I was also asked at the same time to start serving on the governor's task force for other types of child and congregate care settings. And that was just something that I was very honored to do and not thought that was going to take up my next year and a half of life. At that point, though, what we realized is that we had a very tall order, and that was how do we open schools and how do we keep schools safe? And that piece was something that I never want to diminish, is that I didn't even know what that word meant, safe, at that time point. We've done a really good job with all of the kids up in summer camps, but that's a different type of controlled environment than what we dealt with schools. And we had a lot of pushback from a lot of people in the community very early on with the work that we were doing. And by work when I say we, I mean this was not just myself. This was community pediatricians, academic-based pediatricians, other types of mental health providers in our town, worked very closely and have worked for the last year and a half with Blue Ridge Health. And I say that's really has been what has taken up for the last, since then, is that I am very honored to be able to attend weekly meetings with them. I personally have been very ingrained with Albemarle County and the city of Charlottesville. We've run testing drives, we've run vaccination drives, we've done everything we can in order to make sure that we can bring these kids back in school, keep them in school, and do everything we can to keep them safe. But I've also realized that's come with a toll. And that toll has been something that has been really hard for us at Knights to understand, is that our kids are incredibly resilient, and all of us are very willing to do a lot of this stuff, when it was the right thing to do, and it was absolutely the right thing to do. But we also have to understand that kids are not endlessly resilient. And that was something that really hit me even when I saw with my own kids that they at times didn't want to go to school. They were seeing friends that were, they were learning the words quarantine and isolation and virus and who has COVID and is that person going to be okay? And I realized even over the last couple of months that we've done a really poor job of understanding and contextualizing risk for them. And that was what kind of led us to join up forces with a number of pediatricians across the country and public health providers to say, how can we do a better job of contextualizing the public health message and not rely on some of the one-way communications that was happening? And that's kind of where we are, how we got involved with what we were doing today.
All right, so we have, my count, close to 40 questions have already come in the first 9 minutes of the program here. 8 states on the program and 2 countries as we watch here. Let's go to the Urgency of Normal website and the Urgency of Normal toolkit. An advocacy toolkit for parents, students, mentors, teachers, admins, and everyone invested in taking the best possible care of our children. That's verbatim from the website right there. We'll start with you, Dr. Holland.
Yes.
The foundation for this toolkit, why you felt compelled to get involved. From my standpoint, you guys are the experts. I'm a layman, a father of a nearly 4-year-old. I thought the toolkit offered a sense of common sense and clarity that's been needed throughout nearly 2 years of an aggravating, frustrating, vulnerable, uncertain pandemic and time in our lives. Why'd you get involved? Foundation of it, and and did you expect this kind of reaction?
Okay. So multi-part question. I am incredibly honored to be involved with this toolkit. Many of the doctors and scientists who are co-authors are people who I've been following diligently throughout the pandemic because of their middle-of-the-road, common-sense approach to COVID, especially where it relates to children and mental health. Again, I'm a mother of teenagers. I am a pediatric hospitalist. What I have seen in my practice over the past 2 years is a doubling of admissions for eating disorders, the continuation of admissions for overdose, suicidal ideation, suicide attempts. Those admissions far outweigh the number of admissions that we have had for COVID in children. And so I think that is one of the things that is really important to keep in mind is that COVID can be a serious illness, but thankfully children have been spared from a lot of the serious hospitalizations that adults have had. Not to say that children don't get sick and don't get severely ill, but the numbers are so much smaller than in the adult population. I feel very strongly about looking at this through a very common sense lens and really looking at the data and breaking it down into easy to understand tidbits. I have a friend who looked at the toolkit today and she said, wow, after looking at this, I completely feel fine about my daughter being maskless in school. And this is someone who previously felt very strongly about the students staying masked. And I think there's so much information. And as someone said, we're all like trying to drink from a fire hose that is wide open. And so distilling information down.
Wide open in a fire hose that changes literally every day,
yes,
depending on the media and the news we see in the morning.
Mm-hmm. Yes. So things are changing rapidly, but there are some things that have stayed the same. And thankfully, the risk to our children, the low risk to our children from serious disease, is one of those things that has stayed the same. Even through all the different surges, the rate of hospitalization has remained relatively constant. So I think that's really important to remember when we see these news stories that hospitalizations among children are up, and that is absolutely true. But relative to the number of children who are sick and the number of COVID cases, that rate, overall rate, has stayed constant. I do want to say that right now we have a number of children who are in the hospital with a diagnosis of COVID. Over half of those are admitted for reasons, came in for reasons other than COVID. They were just found to be positive on their admission screen. And so I think it's really important to distinguish hospitalized for COVID from hospitalized with COVID. And nationwide, about 50% or more of all hospitalizations that are being branded as COVID are actually with COVID, not for severe COVID symptoms.
And we oftentimes want to make sure that people really understand that that is not diminishing the toll that that does take on a healthcare system to still manage a patient that is COVID positive. And I think that's been oftentimes one of the big retorts. But when we look at policy and how that policy affects things, we have to understand what type of disease burden are we seeing because of that entity. And that's a really, really big motivation for us. Jared, could I also talk about a little bit like how I got into this? So,
Please.
I'm going to be so much more nerdy than Dr. Holland is. I've been a part nationally of writing a lot of different types of guideline papers, and then when we look at guideline papers in our field and we look at this, what we do is we kind of, go through all of the evidence and try and give what we call a level of degree of certainty of evidence, right? We don't say studies are good or studies are bad. We say how effective is those studies at answering the questions we want them to, and were they controlled properly, and how strong do we feel in the decisions? A lot of people in the pandemic want to look things that are black and white, and I wish I could always provide something that says that it's black and white, but we don't have that. We don't know if something is safe or not safe. We know if something has degrees of safety or not degrees of safety, and that's a really important nuanced thing that has kind of driven me in the last couple of weeks, and when we really started this project. I want to be very, very clear. We all of the authors did this volunteer, right? We are not backed by any funding. We are not,
one of my questions.
Yeah, we are not receiving anything for this. The website was free of charge. The design people are donating their time. The docs are donating their time, and it's been a lot of time, recently. And so, we have no funding. I will never take a dime for any work that I've ever done related to the COVID pandemic. I never have, and I never will. That's the other big thing that I think we have to understand is our goal was not to come together and create a checklist of what everybody needs to do, right? We were not wanting to tell people what they need to do. We were trying to do exactly what you said. We were trying to provide information to empower people to bring back to their communities and understand how we move forward with normalizing lives for our kids in the ways that fits that community. What works for Charlottesville, Albemarle does not work for Greene, does not work for Nelson, Fluvanna, Louisa, Richmond, Fairfax. All the areas that you are talking are very, very different. And part of that is the science that we talk about very extensively in the toolkit, but so much of it also is what the feelings of the community and understanding fears within the community and what the community is okay and acceptable with from a risk-benefit ratio. I can't stress that enough, that we are not here to tell people what to do. I have turned down at least 10 emails in the just this morning, asking me to go speak to school boards across the country and tell them what to do. And it's a very easy copy paste to say, absolutely not. Like, I wouldn't even do that to our own school board here in Albemarle County. They have to serve a very, very different need than just what is the science that's showing. But that science is muddied, and that science has been politicized, and that science is something that has to be taken with gradation and context to really be able to understand in a simple way, and that was our goal, is to boil that down.
Multiple doctors commenting on the feed now. Okay, I promise you guys we'll get to these questions and these comments here. We are live on every social media platform known to mankind now. I want to offer some perspective here. Undoubtedly, this pandemic became a political tool in the Trump-Biden election. If this pandemic had transpired outside of the most divisive election in American history, this country would be way more unified than it is now, and that is a factual statement. Furthermore, this topic has been undoubtedly has tailwinds behind it, or gas on the fire, when Governor Youngkin was running on a campaign that said, we're going to empower parents, and if you vote me into the governor's mansion, this is what I'm going to do. And he literally did this on the first day. And that has further divided the community, undoubtedly. I think what we're trying to do here, and what we did yesterday and throughout the week, is offer both sides' perspective for you, the viewer and the listener, so you can learn and you can choose what's best for you. I've said many times here, I'm in the pro-choice camp. My wife is cautious with our son. He's going to wear a mask to school, but I want the choice for us as parents to determine what we're going to do with our kids. So I've put that out there. I'm going to get the take here from the doctors here in a matter of moments. Before we do, I want to ask you more questions about the toolkit. The slide that's gotten the most attention is the mask slides. Is that safe to say?
Yeah, safe to say, and I will tell all the viewers out there, we gave a webinar on this, and I drew the short straw to be the one to walk the nation through that. And rightfully so. It was something that I felt that I could do with some degrees of grace and humility. This was not just about masks. All of this was not just about masks, and it was very purposeful that it was put at the end, and it was very purposeful that it was listed as an appendix. And that was because we don't want this to just be about taking masks off of kids, right? So much of what is embroiled in that is not just the mask. It is aspects of understanding how risky is that disease in that patient in that school, or in that child in that school. It's very much understanding how do quarantine and isolation rules go into, and we purposely couldn't address all of it in the toolkit, but how does that go into a normalcy? It was about kids being able to sit at lunch, and can they talk to each other at lunch? Can they remove their mask? Or are we so focused on the symbol of the mask that it has inhibited our ability to look at how children move through school normally? So you are very fair in saying that, and we knew it was going to be big, but we really felt the need that for everybody to understand this was not just about masks.
Okay. I appreciate and respect that statement there. I'm going to throw this to you, Dr. Holland. The impact of masks when it comes to children, especially our littles. My kid is almost 4.
Right.
Half his life has been in this pandemic. okay? And for a good portion of that time, he's had a mask on. The impact of this could potentially have with someone like our son, who is not seeing mouth cues, facial expressions, who for the most part has been 6 feet away from his peers in a lot of settings. I was having a conversation, this is with a not even 4-year-old on the way to preschool 2 days ago, where he was asking me legitimately concerned about COVID and vaccines. Okay, this is a kid that's not worried about trading his Lunchables or his Dunkaroos at lunch with his buddies, but is instead worried about vaccines and masks and COVID, and it broke my heart. So I want to ask you this question just as a mom, right? Just as a parent. What's this impact that it's having on our kids?
I think that a lot of what we're seeing, what I'm going to say is anecdotal. I have not sat down and read through all the studies. I can tell you what I'm hearing on chatter, which is referrals to speech therapist offices are up. Some people in my Facebook groups are saying it's upwards now of a year to get in with a speech therapist. There are concerns about language, about socialization. There's certainly a number of people who said their kids are doing fantastic in mask. So I think you could ask 100 people and you're going to get 100 different answers. I asked my 16-year-old daughter the other day what impact masking had on her and her classmates at school, and she said the biggest thing is it's really hard to hear people. And so if you're talking about it's hard to hear your classmates in an educational setting where that dialogue is such an important part of your learning, that's a thing. I mean, I think we should be listening to the students. I think there's also the impact of not really being able to be close to your friends. Teenage girls like to cluster together, and they have been encouraged to stand apart. Don't cluster together. You have the impact on the teachers of feeling like they need to come up to the kids all the time and remind them to pull their mask up, remind them not to be so close together. I heard a story from a woman the other day whose teenage daughter they live outside of Charlottesville. Her teenage daughter was talking to some friends and came up and made a statement to the effect of, if you get COVID, you're going to kill your younger brother because he can't quite be vaccinated. So there's that sort of pressure. And again, I haven't looked at the studies. I think time will tell when we look back through all of this. But it's not a normal way of being. Right? And kids are so dependent on their peers for that socialization. Teenagers were meant to be with their friends. That should be their primary source of companionship and
socialization. How they mature, yes. How they grow up. How about if we compound that, and I'll throw this to you, Jeff, with increased screen time, with virtual learning, with isolation, and added anxiety levels.
Yeah, I think I've said this oftentimes before, the one thing that is awesome about, what Liza and I do in pediatrics is that kids don't want to be defined by their illness. They're just, even in the hospital in their sickest of sick states, sometimes they're just really enjoyable to take care of, right? I don't want to say that's not true for adult medicine as well, but it's really rewarding, what we do in pediatrics. But what we have to understand is that kids are also incredibly, incredibly fragile. And what do I mean by that when I just said that they're resilient is that they are creatures of comfort, right? They are very much into their routine, and when things kind of shift with that degree, very much so, it's a good life lesson early on, and why all of us, I don't think there's anyone on this call or anyone sitting in this room right now that was not very involved early in the pandemic, especially before we had widespread vaccination, to say we need to be all hands on deck, and we're all willing to make these sacrifices for the short term. The question is the long term, right? Those are the things that we don't really understand, and I will tell you the data is very gray on this. We don't understand the long-term data, on what it's going to be, and how this is going to affect our kids, and we're probably not going to really understand that for a couple of years. But I don't think any of us would say that a kid should be in the mask forever. And so the question is never not should we start relaxing these. The question always tends to become when, because that is such a key part to all of that normalization, Jerry, that you talk about, right? It's such a key part to understand that every kid has a different worldview in that, and that we can't minimize that worldview. We could very much, I think when the pandemic was in a certain situation, we have to start asking the questions now about when we can shift away from that.
So multiple people are asking about the toolkit, and we've pasted the link to the toolkit in all social platforms for you guys to reference. So look on any social platform you're watching upon. It's in the comment sections now. Now, I want to be mindful of the viewers and listeners that are watching the program here. You mentioned the data is unknown for collateral damage associated with prolonged mask wearing, prolonged isolation, and prolonged screen time, which everyone's experiencing right now. I want to be mindful of the other side. Is the data also unknown for long COVID and the impact that long COVID could have here? Because tons of moms are asking about this as we speak.
So can I start with this? I think it is really important for people to understand that every single viral illness has the potential to cause long symptoms. So pre-COVID, think about mono. Those kids, when they got sick with mono, they would be fatigued for weeks. Our babies who come in with RSV, we tell the parents to expect that they're going to cough for 2 weeks or more. Again, personally, I've had viral illnesses as an adult where I've been wiped out and coughing for 6 weeks. So what COVID is showing us as far as long symptoms is commensurate with what we have seen with some other viral illnesses in the past. Also, long COVID is a grab bag. There is not a concise definition for what that means. So for some people, it's they're fatigued and have brain fog for a week. For some people, they feel dizzy when they stand up. They have prolonged cough. My husband had COVID 2 weeks ago, or a week and a half ago, and he is still feeling short of breath when he exercises. So he might be going on to long COVID. We'll see. But so it is a grab bag. It's a diagnosis over time. It is, a lot of the symptoms are similar to other prolonged post-viral illness issues. And there's a study that's referenced in the toolkit that looking at symptoms of long COVID, the percentage of children who had symptoms of long COVID after they had COVID was the same. I'm not going to say this in a way that's going to make sense, but they interviewed then a group of children who had never had COVID, and the same percentage of children had similar symptoms. So I think it's really hard to tease out, especially in the midst of everything else what's going on, what are true long COVID symptoms and what are symptoms of just the stress and anxiety that we're all living under right now.
Jeff, want to add to that?
No, I couldn't agree more. In pediatric cardiology, we see a lot of these patients because they do come in with a lot of non-specific complaints that would be referable to the cardiovascular system. And I think there's a couple of big themes that have come out of this pandemic, and this is one of the big ones that I think it's opening up a lot of people's minds to things that they thought never existed that COVID has brought on. And that's not true. All of the buzz terms that people have now been hearing about, we see with other viral illnesses in pediatrics. I see it all the time, and we've seen it for years, and we're going to continue to see it for years. So it's not surprising we'll see it associated with the most dominant circulating virus right now.
So we have questions. We'll take questions. Again, we'll take questions as long as they're respectful of the doctors. This is from Post Falls, Idaho, from a mom watching in Post Falls, Idaho. Please ask the panel about our little ones who are not yet vaccinated and whether or not mass prioritization should be a focal point for parents. I understand middle school and high school who have been vaccinated and boosted, but right now our littles are not vaccinated under 5.
Okay. I cannot emphasize enough that children are at such low risk from severe disease for COVID. And I think a 50-year-old who is vaccinated still has a higher risk of severe disease and hospitalization than a 10-year-old who is unvaccinated. So this is one of the high points of this pandemic, if we can say that there's been a high point, is that our children are not as severely affected by COVID. Many of them will have it and you may not know it. It may be a cold that you can treat like any other viral illness at home. We just aren't seeing that many young unvaccinated children coming into the hospital. And when they are coming into the hospital, the symptoms are exactly like all the other viral syndromes that we've been treating in the past. This is another high point of COVID, at least in pediatrics, is COVID is showing us almost nothing in children that we haven't already seen and know how to treat with other illnesses.
It's a really important point, Liza. I think I would say to that mom, and I'm looking right at you at this point, that I hear your fear in that. It's really hard to understand how we wrap our heads around the unknown. And I was in that same camp, or in the early part of these months of not knowing what we would think about with the littlest of kids because we are so concerned about their fragility. We now know the answer to that, though. Right? We have 2 years worth to understand of who are the kids that we think are at risk. We know that kids with obesity and asthma are at much higher risk, right? I know that kids with congenital heart disease, my field, are overall really not appearing to be at significant risk. We know that the teenagers have seemed to be some of the sickest ones, right? They, without a doubt, have done that. We know that we have all been caring for tons of babies that we're like, wow, if there's any kid that should get sick in the hospital, it should be this one, and they haven't. I can't tell any parent that their child has no risk. I can just tell very clearly that when we look at the age range of pediatric patients, it is just exceedingly rare to have very sick children with this, and it is even more rare to have very sick young children with this.
Okay, we'll get to the questions, guys, from Nashville, from Connecticut, from Ottawa, and the ones from Charlottesville. This is one from a guest that is coming on the show tomorrow. This is Dr. Karen Wolfe, who's a physician at Pediatric and Associates here in Charlottesville, Virginia. Obviously, we have a very wide audience on a topic like this. So our guest tomorrow is a physician at, you can make strong statement, one of the most popular pediatric offices in town, Pediatric and Associates, which is down the road, their downtown office from where we're filming here. Multiple comments from Dr. Wolfe. Okay, I'll read them to you guys as they have come in from start to finish and then throw the ball to you. I would like to know how the admissions for eating disorders and mental illness has changed over the last 4 months. I have seen an enormous reduction in new mental health diagnoses since children have been back in school. She adds, my colleagues in primary care pediatrics are reporting the same trend I'm seeing. My patients who had admissions for eating disorders this fall started worsening while in virtual school. She says the quotes that Dr. Vergales chose to include from the studies he quoted do not represent the conclusions of the study. The American Academy of Pediatrics and the American Speech Language Hearing Association both report there is no evidence that masks cause speech or language delay. And then lastly, how do they feel about the fact that we are several weeks out from knowing what the impact of Omicron or MS-C is? Okay. There's a lot right there.
There's a lot right there. And
Liza, why don't you take
I'm going to take a couple of those. So I am thrilled that your eating disorder patients are doing better since they are back in school. Our admissions for eating disorder at the hospital have not slowed down. When we look at our 2020 numbers, they are double what they were the year before, and truly, as soon as lockdown started, we went from one eating disorder admission every 2 months or so to pretty much one a week. We have sometimes up to 3 at a time, and so these are a small fraction of the number of eating disorders that are out in the community. We only admit the ones who are medically unstable. So we are seeing the sickest of the sick eating disorders. So we can extrapolate that if we are, our population has doubled, the eating disorder population has exploded. And I think the data from other places bears that out. As far as MIS-C, the data with Omicron right now as it stands is really encouraging. I was actually looking at this earlier. So even though the Omicron numbers are going up, the MIS-C numbers are going down. and this came up on our webinar the other night as well, that association right now doesn't seem to be bearing out the same way it was in other surges. The MIS-C is very similar to another disease process called Kawasaki disease. It's basically your immune system goes crazy after an infection. We have been treating Kawasaki disease in pediatrics for years and years, and it turns out that the same medicines that we use for Kawasaki disease are incredibly effective with MIS-C. They're probably on a spectrum of disease. So yes, absolutely, we've had some kids with MIS-C who end up in the ICU and they're really sick. But a lot of our MIS-C patients have come to the general pediatric floor and they get the medications and they go home after a couple of days. The long-term data, there's not a lot of long-term data out yet because we're really just 22 months into this. But there was a study in the fall that the long-term outcomes for these patients up to that point was really good. And I think Dr. Vergales can speak to this since these are kids who would follow up in cardiology clinic.
Yeah, we haven't seen a lot of long-term issues with the patients that have had with MIS-C, and I've seen loads of them at this point. There is a multi-center trial called the MUSIC study that is going to be looking at this, and we should have some good data about MIS-C. But I think to Dr. Wolfe's point, which is a very, very, very important one, is that how do we know with the regular Omicron surge what exactly is going to happen with MIS-C? And the key is that we have two reasons to feel overall very, very reassured that this is not going to be a problem for us. And the one is that we saw trends of MIS-C going way down even with the Delta surge. So if the CDC put out this data really even just a couple of weeks ago and finalized it, that demonstrated very clearly that we saw most of our MIS-C with the alpha and beta circulating variants. Once Delta really kind of hit, our MIC numbers went way down. And at this point, we are a solid month into Omicron. And with Omicron, we would have expected to start seeing them in earlier parts of the country. We also have a really good ability to look at other countries. And I think this is something that I would like to impart to all of your listeners is that, America is awesome. I love my country very much. But there are really good scientists in other countries as well. And it's important for us to take the world view as well to kind of help learn. And Italy and the UK have always been weeks in front of us when it comes to various surges. And so we're able to lean on their experience very significantly because they serve very similar populations. And we have not seen big spikes of MIS-C. I want to take her other kind of two questions, that were brought up. The first big one is, about interpretations of the mass studies and what the AAP has come out and said. And I really want to make sure that everybody understands our point and our goal. I am incredibly pro-mask. I am absolutely pro-mask. I use masks every day in my work. I used it before then. I'm going to use it after then. The questions that we try to ask with the studies is how well they answered about the real-world use of a mask, and that is a very, very different a very, very different question that we can turn to research to be able to answer. In the toolkit, our results and our interpretations are dealt with the exact same lens that I would review anything. When I review how we work up chest pain, when I review certain medications' effects on the public level, we use the same rubrics exactly the same way that we would do for anything else. And the results that we have are pulled directly from those studies. I think if people go and actually read the studies, they will see that the limitations and the concerns that those people have are coming directly from those reports. We have not shifted information, made up data, or anything like that. The AAP, as a general rule, is going to always kind of take that and understand the needs of what it serves. And so I was very, very pro the AAP coming out with statements. I'm a very active member of the AAP, by the way. And I was very pro the AAP coming out with those statements early on when we had no ideas of what we were doing and how this was being utilized. They've been a little slow in order to really kind of start to change those, and that's not a fault of them, that's just a fault of kind of where we are a little bit kind of in our society very specifically. But I stand by what we have said, as far as what the data shows about masking. Again, when you start to talk about putting it into real world, that is a very, very different phenomenon. And I will be very clear, in our own community, Jerry, I have been very vocal that I do not think we should make any changes, and I have told this to ACPS, CCS, all of the private schools, that I meet with weekly, that we should not make any changes until we are through what we are currently seeing right now with our hospitals. I've been very, very clear about that. This was not about flipping on a light switch and telling things that we need to do. Instead, it was about how do we start to tell people that in those couple of weeks, we're going to start to have some decisions that we need to make, that we need to start wrapping our heads around.
Okay, so follow-up question for me, and then we'll get to Jennifer, who's watching in Glastonbury, Connecticut, and then we have a mom who's watching in Sarasota, Florida with questions here. This is the follow-up question for me. How Governor Youngkin handled the pulling of the mandate. Do we think that, and this is not a medical question, this is about just being parents here, was that fiscally irresponsible of how he flipped the switch that quickly? Or should he, in your eyes, have waited to this Omicron surge of tapered off a little bit?
Boy, that was a good one. That's an excellent question. I'll start if that's all right.
Go nuts.
He campaigned on that.
Yeah, and I am a very apolitical person, so I want to understand that that's a very, very that's an excellent question, and I don't want to talk about whether a governor, as a general rule, should initially enact. I will say it's been hard on communities that were not yet ready to hear that. And I think we're seeing that locally, right? The truth of the matter, though, is that I love CVille, right? I love Albemarle. I love where I live. But the needs of our community is very, very different from the needs of that surround. And we had to be very, very cognizant as pediatrician and providers that while it doesn't sit well here, and it doesn't sit well in Fairfax, and it doesn't sit well in Richmond, and it doesn't sit well in theirs, it sat exactly well in other communities. And for me to then go and say, well, you're wrong to do this right now, right? For me to tell those school boards, well, you're wrong, or the teachers, or the parents, or the students that, well, Albemarle and Charlottesville are doing it exactly right, and Green, you're doing it wrong. I can't do that as a physician, as a pediatrician, as someone who really looks very strongly at this data to say, are they doing it wrong? Because the data would not suggest that they are making a bad decision. But I would say it cut it was hard, and it was a hard couple of weeks for a lot of us. And a lot of us really understand, because the most important thing is whether or not it was the right thing to do, and I'm going to stay out of that decision. I think people kind of interpret what we're arguing for. The timing was really hard for schools to all of a sudden figure out how to wrap their head around how to operationalize it. And we need, most importantly at this point, to support our schools in figuring out what the best thing is for their school environment.
Well said, you handled that well. The natural follow-up for you guys would be the hashtag that is kind of trending on Twitter. There's two. There's the urgency of normal hashtag, and the other hashtag that's trending is the urgency of equity hashtag that's trending. And this is a natural follow-up to this topic here. And the question is coming in, why are the needs of communities different? It's coming in from the Keswick neighborhood, from Keswick, okay? So the follow-up to that would be, not every community, and I'll throw this to either of you guys, not every community is as resourced as ours. We're fortunate to live in Albemarle. There is undoubtedly a lot of wealth here. I think there's been a direct correlation between wealth and vaccination rates. It's tough to argue against that. And the vaccination rate in this community is astronomically high. So the urgency of equity hashtag that's trending, just like the urgency of normal hashtag that's trending, basically is saying it's not fair to all communities, certainly the ones that are under-resourced, to have this push for some of the items in the toolkit that you guys have accentuated. Do you guys want to touch on that one there?
So I think the toolkit says very explicitly that this is geared towards areas of high vaccination.
It does say that.
And absolutely. So again, there's not going to be a one-size-fits-all. And I think the point of the toolkit was to give people information, one, about the risk of COVID, especially the risk of COVID in children, some of the issues that we've seen with school closures, and then to give some recommendations. And the toolkit's not going to be right for every community at this time. It's to start discussion. Again, it's not to tell people what to do.
Not a silver bullet, but a silver buckshot, is what you're saying.
Sure.
Yeah, that's what you said.
Great.
So parents, the response here is Guys, I'm going to try to get to as many of these questions as possible. I promise you I will try to get to as many of these questions here. The cloth mask versus the medical mask. Are the cloth mask even doing anything? My kid's been going to school with the Captain America cloth mask on. Is that offering any value proposition whatsoever?
Well, if it has Captain America on it, probably.
Gives an extra layer of protection.
You touched on this in the toolkit.
Yeah, we do touch a little bit on this toolkit, and so I think I'm very comfortable answering this. So you have to understand that this is another important thing about context and where we were in 2020 and where we are now in 2022. In 2020, we had nothing. We had no therapeutics, we had no knowledge, we had no vaccines, we had no immunity. That is what made this virus so scary and truly so impactful in our world, right? We had never seen it before. And because we had never seen it before, it had the potential and proved to be true to spread like wildfire and cause a significant amount of illness. Without a doubt, we knew that in early studies that was coming out from the NIH, that cloth masks probably cut down some of the degrees of transmission of that in a non-immune population by 50%. We also knew this virus grew exponentially. You cut something down by 50%, that's a huge impact, right? You go from one person giving it to 2 to 4 to 8 to 16, and you can see how instantly you can really, really drop that. And so that's why, yes, they were 100% absolutely doing things, and they were working, exceedingly well. The problem is now you impute immunity into the population, and that's both natural immunity, vaccinated immunity, meaning the amounts of tens of millions of people and probably hundreds of millions of people at this point that have had, exposure to COVID, and now the also hundreds of millions of people that have been vaccinated with COVID. Now we have to say, what is the same effect that we are seeing with that? And as the virus becomes much more contagious, which is what we see with Delta and Omicron, it's very, very clear at this time point that our masks are probably in the cloth variety are not doing what they were, right? They don't have that same impact that we had when we had such a non-immune and not nearly as contagious virus because of that situation that we have now. And so a lot of the recommendations, you saw the CDC said this. I promise this is not my opinion. This is also the opinion of the CDC. And it said we should be upgrading our masks in order to prevent this. And the truth of the matter is I agree with that standpoint. If you want to look at the ability to filter out COVID, it is clear that we need more than a cloth mask at this time point. The problem is that we also know that those types of masking things in children is the Wild West. Right, and has not been shown to be something that we can roll out in a kid's environment. Right, they have to be fit tested. They fit different faces. This is not something.
We have to loop the mask twice around for his ear just to have it sit snug on his face.
Yeah,
it's not made for every kid-sized face. Is what you're saying.
And respirators are not comfortable to sit in for prolonged periods of time, and I would posit because of that you have to understand this is why we emphasize kind of within the words of the toolkit is that we have to be very cognizant of how our kids are actually able to utilize a mask at this point. And if we don't see the effects that we were seeing early on, is it time to start asking the question, is this a meaningful thing to us to put all of our energies into? You talk about resource utilization in some of these communities, and the amount of resource and time and energy, probably more, that people are putting into this is really, really high. And we want people to be able to focus on things that we think have meaningful impact right now, as opposed to things that we think have less of impact than they did previously.
In business terms, that's called an opportunity cost, guys.
Yeah.
Dr. Holland, your thoughts on this?
Oh, gosh. So I wanted to follow up with another story because apparently I like those. But so my husband is a physician. He's in a private practice, and he was saying to me that he really didn't like wearing his N95 because it made his glasses fog up. And I was like, well, if your glasses are fogging up, it's not fit the right way. And like I said, he's not in a major health system. Like Dr. Vergales and I go every year and we get our N95 special fit, and there's like 7 different options, and we know exactly which one we should be wearing. But if a physician in the community doesn't have the resources to get fit tested when he needs it in his office, I think to assume that community members are going to get all going to get N95s that are fit especially to their face is not realistic.
On a public health level.
On a public health level,
not
yes.
necessarily on an individual level.
But I do think if this mitigation method is not working the way that we anticipated, is it time to let it go and put resources other places. I completely agree with Dr. Vergales.
And I think the thing that I want, especially your listeners, and we talk about this a lot, when we talk to schools and things like that, is that our other countries and other states have done this a long time ago, right? And we don't want to ignore their worldview.
Done what specifically? Are you talking about what Denmark announced today, where they're transitioning to endemic? Spain, United Kingdom, is that what you're referencing?
No, not specifically. I'm talking specifically with how they utilize masks in schools.
Okay.
So, we are now one of only a handful of countries that do this, and we are probably the only country that does it in elementary age children. And in Virginia, we were a pretty solid in our Virginia, but we are still one of only a few states that have it as part of the framework within our states. And so this is not a new concept, and this is something that I think that we have to kind of wrap our heads around, because we are one of the last groups to really do this. And yet, within the world and within other states, we have seen the same in-school type transmission, even through Delta, and especially even through Omicron, that are the reports that are coming out, again, through some of the other countries that are ahead of us with this. And so I think that's back to the questions that we have to ask ourselves is, are we the ones that are able to do it better? Is the people that are still utilizing this, do we know something that the rest of the world doesn't know? And I'll be truthfully honest, I don't know the answer to that question, but it's one that we do need to ask ourselves.
So you guys have 9 states and 4 countries on the feed right now. This is from Sarasota, Florida, and we'll get to the comments that I just made about Denmark that have clearly sparked some outrage on the feed right here, as it does. This is from Sarasota, Florida, and a mom that has twins under 5. Should we test for COVID and check antibodies before deciding to get our kids vaccinated?
Oh,
I could probably. I'll be very clear on that. The answer right now is no. I believe very strongly in the scientific method, and I believe very, very strongly in understanding whenever we bring a therapeutic to market, such as a vaccine, we need to have the results of controlled studies to know what to do with that. We do not have results of controlled studies in the under 5, so we don't know how antibody levels and all of that would affect anything. We don't have safety profile in the vaccine yet, and I would say very strongly we need to wait for that to come out.
Okay, so I just want to be clear here. Are you saying once they get to 5 to get vaxxed?
I see what you're saying. I see what you're asking. So I think once kids that are of age that we have data on what they do, I feel incredibly strongly about this vaccine.
Okay.
Me and another author wrote a big article in Time Magazine about this just a couple of months ago. That the framework of this vaccine for kids that are eligible for it fits exactly within the framework of every other childhood vaccine that we give. And all of us on the toolkit, not just Dr. Holland, are strongly supportive of this vaccine, and we are strongly supportive of doctors talking to their patients about it. But I won't make any comments under 5 because we don't have the data or the safety profile on that yet.
You cringed slightly moments ago. What was on your mind there?
I think that, and again, this is my personal opinion, if you have a child who has already had COVID, I think there's some room for discussion with your pediatrician about whether your child needs both shots of the vaccine versus just one shot to boost their natural immunity. I
would agree wholeheartedly with that statement, and I would also add that's not something we knew a year and a half ago. Right, we did, or even a year. I shouldn't say that, a year and a half ago. That we didn't even know a year ago or 6 months ago when these vaccines became more mainstay. We have that data right now. The New England Journal of Medicine has published that data. We see that. We've seen that data out of the UK as well. That we understand about that, and I think those conversations have to be had between physician and parent to understand how we put that in the context of what we think they've been exposed to in the past.
Is this vaccine essentially going to be one similar to the flu where we get every year that changes like a different cocktail? And maybe that's not the right language. I'm speaking as a layman here. Or is this something that is one and done? And I mean, are we going to have a vaccine like this every year?
That's a great question, and I think that your comparison to the flu vaccine is very apt for this. When it first came out, we were hopeful that we would get our vaccine and this would really help drive COVID into a more endemic phase faster, and it became pretty evident over the summer with the Massachusetts outbreak that vaccinated people were still able to spread the disease. And when that became apparent, then the conversation around vaccines should have shifted to that it is more like the flu vaccine. It's not a sterilizing vaccine. This vaccine very clearly protects you. And so the data, yes, people who have been vaccinated and boosted are still getting COVID, but the data about the vaccine keeping you out of the hospital and keeping you from getting severe disease is really solid.
And that's why it's such an important tool for what we're talking about today, which is schools, right? And it's such an important tool for understanding at-risk populations in schools and teachers and staff and all of that at schools, is that we can do a really good job as a public health, as schools exist as a public health entity, to prevent people from getting sick. And I would echo Eliza very, very clearly on this. Like, I don't think we know the answer to that yet, but as we've learned that this is a non-sterilizing vaccine, and that we still can be contagious with getting that it has become a much more personal protective, and that's where a lot of our energies need to go towards now.
The word endemic is becoming now very much part of the vocabulary, not only of news, but other countries. And this from Denmark, from Bloomberg today. Denmark will end virus restrictions next week and reclassify COVID-19 as a disease that no longer poses a threat to society, Denmark's Prime Minister announced. The country's decision comes even as infections reach a record high, dramatically pushing forward an idea that's emerged recently in Europe, that it's time to start thinking about COVID as an endemic rather than a pandemic. This also is prevalent in Spain and in the United Kingdom.
Yes.
This topic for you guys.
Yes, I think, didn't Dr. Fauci make a comment similar to this last week?
I'm going to follow up with Fauci for you guys here, okay? Fauci's another hot topic, okay? How about endemic first before we get to Fauci?
So I would say, Liza and I are not virologists, and so I think, there's so much that goes into what that definition of what endemic looks like, and I am not going to pretend to be an expert on this, but I will say part of that is also the mindset that the society that it exists is willing to accept. And parts of our society are willing to accept that, parts of our society are not. And we have to be okay with both of those, right? We have to be able to help the people that aren't. We have to be able to support the people that are, and meet people, most importantly, where they are, right? That's a principle of medicine. It's a principle of public health. I can't tell you who smoked for 40 years, just stop smoking, right? I have to meet you where you are. And that's very true for what we view as what's an endemic here. We're seeing signs of it. We're seeing signs of it even locally, where, our mitigation profiles that are going to happen in this state and others are going to move much towards a containment strategy to looking more at outbreak strategy. That's has been announced already. And so I think we're moving that direction, but we are going to be behind Europe, without a doubt, in saying that.
Dr. Holland, anything you want to add to that?
No, I think that the public health messaging around COVID throughout this pandemic could have been better.
That's an understatement. Yeah. And I understand why you put it that way. And completely, I'm able perhaps to offer more of a pointed opinion. The public messaging, the perception, the instructions from Fauci in particular, from my standpoint, has been awful, and it's caused confusion amongst us as Americans.
Okay, I'd offer a thought on that.
Okay, please do.
We as doctors hate being wrong, right? We want to go in and tell a patient it's going to be okay. We want to tell a patient this is what this is, and this is how you're going to get better, or you're not going to get better. We kind of suck at nuance, right? We suck at understanding about how we can tell things. Like, early on, we never should have said, masks don't work, don't put them on, right? We should have very simply said, we don't think that masks work, but we need to continue to be flexible that maybe it is.
Or how about the statement from him about vaccinations will keep you from getting COVID?
Yeah.
And I think a lot of this, right, we can sit here and Monday morning quarterback
That's
about
fair.
things
Right.
that were said, because science is an evolving process.
That's
and
fair.
we are living through an experiment right now. I think that unfortunately, the public health messaging has not been keeping up with what we're realizing. So there were signs long ago that this was moving towards an endemic stage, that we were never, or maybe that we were never going to get to COVID zero. And I think, again, when it became apparent over the summer that if you were vaccinated, you could still get and spread COVID, that was a pretty good sign that it was going to be really hard to get to zero COVID. So now I feel like we're all kind of, as a country, playing catch up, because we went from, we thought we were going to be able to get rid of this thing, and if we all got vaccinated and did what we were supposed to do, it was going to go away and not being a problem. And now we're being told this is going to be with us forever. And then how do you shift from this high gear, we need to vaccinate and we need to mask and you need to test before you go see your grandmom, to, well, we're going to be living with it, so we've got to wrap our head around it. Like, that is a huge mental shift for people, and I think that's where a lot of the community is getting tripped up, and just going from being like afraid all the time of making a misstep and getting COVID and accidentally infecting everyone, to getting to the point where we're swimming in it, and how do you de-escalate?
Well said.
And we hope, back to kind of even our toolkit, we hope that becomes to some degree a living, breathing document, right? You know, I mean, we stand by what it says today, right? It may be out of date in a month, right? And we will own up to that, and we will continue to try and change that. We'll continue to try and ask the honest questions that a lot of us in medicine feel that we can't ask, because it goes against a little bit of what the current dogma is. And so I just could not agree with you more, Eliza. Like, it is hard for people to wrap their head around how we go from 100 miles an hour to 0 miles an hour. And it's so important for us as physicians to be honest about what, you know, and not use words like, well, this is safe and this is not safe, right? You know, and look at people individually and say, well, you know, for you, this may be safe. You know, this is probably a better argument. Things that we've been doing in medicine all the time, you know, and forever.
More comments. We'll get to as many here as possible, guys. I'm certainly mindful of time. Here. 4 countries and 16 states watching you guys on our heat map here. Stephanie Renshaw, who's a pediatrician, has this. Some people are very clearly anti-vaccine at this point, and I am not optimistic they will ever change their mind. How does your toolkit or strategies going forward help reduce the vaccination gap? And is that even your responsibility, or is that the responsibility of PR campaigns, policymakers, and stakeholders and communities that aren't in medicine?
I actually think it's the responsibility of the individual's physician, because really, and Jeff may feel differently. I feel like all of our PR campaigns and our outreaches, we've done a lot. And there are a lot of different reasons that people don't want to be vaccinated, but the way to change someone's mind is through a face-to-face conversation. It's not to make them feel shamed by public health messaging or social media or the news. And I feel very, very strongly about this, because our unvaccinated population, that's exactly what's happened to a lot of these people, is they have been shamed, and no one's mind has ever been changed by shame. Right? And far more people are swayed by these one-on-one conversations, or some people, they're listening to a podcast of people that they think is reasonable. It's like, hey, I hear what your reservations are. Let's talk about them in a reasonable way. But I cannot stress enough the personal connections. It's not that vaccines aren't available. It's not that the Blue Ridge Health Department hasn't done a fabulous job getting out into the communities. I've gone out and given vaccines in people's homes. Like, I don't know.
No, I don't at all. I will say, as a quick plug, the Blue Ridge Health Department is the model for what can be accomplished with going out into the public and doing this. That Jen Fleischer and her team at Blue Ridge Health, I could not say enough nice things, and yet they're not even perfect, right? And I think they're still struggling with how do we reach some of those individuals. Pediatricians have been dealing with vaccine hesitancy for as long as vaccines have been around. I am highly biased in this, but we are the experts in how to sit down with a family and bring them through that, and deal with their individual fears and whatnot. The people that were going to get vaccinated, they have. We've done such a good job with outreach of people that wanted to, but couldn't get there. Was it transportation? And Eliza and I both have gone to the community. I've driven to people's homes, in our community, who didn't have transportation to give them the vaccine. And so, from that standpoint, there's only so far we can get. We have to be okay returning that conversation to the medical home and the PCP.
I totally agree. And I feel very strongly about this. I feel like the people who are currently unvaccinated, who are eligible, this is not the under 5 crowd. Yeah. This is mostly adults who remain unvaccinated. They feel marginalized. And our public health messaging towards them has also been horrific. And so how do you go back out and reach these people where they are instead of continuing to marginalize them and make them feel penalized? And now, especially since people who have been vaccinated and boosted are getting COVID and spreading it, the message has been, you are a horrible person because you chose not to get vaccinated and you're going to kill grandma. And now it's evident that even people who did the right thing and got vaccinated are still spreading it. So meanwhile, we have this group that we really need to bring in, and we've just been pushing them farther and farther to the side. So it really needs to be empathy and compassion, and let me help you reach that point or not. And how can I support you if you don't make that decision?
What do you think, Jeff?
I couldn't agree more. We can't, just like I feel with schools in our communities and stuff, what is good for Charlottesville is not good for, those surrounding counties. What is good for one person is not always good for the other person. And the way that we enact change with that is we support both of them, right? And we have to be at this position that we can support both of them, because what you're going to see is that we are going to actually be able to slowly over time bring those people around. Most people, there's always exceptions, want to do the right thing, and at times they can be scared. My interesting story about that is that I, have frequently given vaccines to various clinics that have been set up to deal with people that may need that further work. And I thought I was going in there and it was going to be like, people throwing haymakers at me, I don't want to get this, and things like that. And I learned something really powerful at that moment. About half the people were that and were swearing at me because they didn't want to get it. And the other half of the people were just scared, right? And they just didn't know what to think because they had so many people in their ear talking. And I think that we purposely didn't talk about, add toolkits for vaccination, because there's some good ones out there that really go through the evidence, and we didn't think we were adding since we were taking an evidence-based piece. But that has to live within people they trust, and they may not trust me.
You have one city councilor, 2 board of supervisors, and a handful of state delegates watching you guys on the show right now. A couple more questions for you. This from Mike. I'm curious of your take on this. COVID is much more similar to the flu than it is to polio or smallpox. If you get the polio vaccine, you never get polio. If you get 3 COVID shots in a year, you can still get COVID really easily. It seems to me that the COVID vaccine is far more similar to the flu vaccine, reduces hospitalizations and deaths, but does not stop the spread. Multiple people are engaging with that comment here. Do we want to touch on that at all?
I can at least talk about the spread piece. We do still relatively believe that you are less likely to spread it if you are vaccinated. Understand that key. You are less likely, right? You are not likely. Or
can we characterize a percentage at all? Or are you hesitant to do so?
I would say I'm very hesitant to do so because the data that came out pre-Delta. And we know that Omicron and Delta have had more immune abilities to go around that. And so we don't know that yet. We'll probably know that better in a month or 2 or whatnot, but we don't know that yet. And so but I would say to Mike, you're probably right. And again, I'm not a vaccinologist, and so I don't want to say that I know this, right? But in the contextual framework of what we consider to be a sterilizing vaccine and one that is able to eradicate a disease, coronavirus is a very, very different type of disease, and it's why people have been talking about its pandemic potential for a long time. It's a slower mutator, right? It has a animal host. It has an animal vector that can pass, and all of those make it have an ability to be able to, evade vaccine to some degree. But that goes exactly to your point, that the flu vaccine is also the same way. It doesn't prevent you getting the flu. It allows you to continue to see versions and versions of it so that you have an ability to fight it off. And that's why this vaccine is also so important. It does a phenomenal job of preventing severe disease.
We have our favorite hound dog outside the studio right now. The owner of the hound dog loves to patronize the grocery store next to our studio around lunchtime. Pretty much every day. We're super grateful for that. We'll take 3 more questions and then we'll end. This is from Twitter, and it's from Brian, okay? This may be a tough question. Does the panel feel that some of the wrong messaging within our community here in Central Virginia has come from the University of Virginia? And does that play a part of where we're at as a community? Because it seems like we're very divided here.
Oh, that is a hot potato of a question.
Because, I'll offer a little context here. When you guys released and published the toolkit, there were certainly a number of your colleagues and peers that responded in bombastic fashion, and I'll leave it at that. I think that's fair.
I am not sure it's so much to do with the messaging out of UVA as much as what we've talked about before is this virus unfortunately has become very politicized. And as a community and as a country, we have become very tribalized, and we feel a lot of allegiance to people who are in our tribe, and we ascribe to a lot of the same beliefs. And this unfortunately, I think has accelerated some of that. And people are living within their groups. And it's human nature, right? It's hard to hear opinions that are different than yours and that challenge some of your core beliefs. One of my mentors gave a great talk a couple of years ago about things that she's learned. And one of the things she said is that person who annoys you because they're always going against you, that's the person that you want to have on your committee, because you need to have that dissenting voice around you. And if they're bugging you, it's because they're challenging something in you, and you need to be willing to open up and listen to what they say.
I don't think the messaging coming out of our super local area has been any different than the messaging that has been coming from everywhere. And I think it's been as honest as we can be, and I think it's been as understanding that it has to reach people that have drastically different beliefs. And that's no small feat. And UVA is a behemoth of a place. And so, trying to steer a ship like that when you have lots of people that are, much smarter than Liza and I are, that have just as equal valid opinions as us, can be hard. And so I've been very proud of the work that UVA has done in the community and what they've said. And, Wendy Horton, our CEO, was just doing a campaign just yesterday to try to continue to encourage vaccination in our area for the places that aren't. And I just couldn't be more behind that. And Liza's right. I think there's colleagues of ours, friends of ours, both within our own institution and in the community, that absolutely don't agree with us. And
are you surprised by the backlash? Because the backlash, there's, this is from personal opinion, okay, from personal perspective. Doing a show like this that reaches a lot of people, where you're giving your opinion on a lot of different topics, and a lot of it is political, I understand what it's like to get backlash, and that's just part of it, okay? And it's a matter of having thick skin and understanding that the platform is vast and it's going to come with it. But backlash that gets nasty, that stings. And does it not sting?
It absolutely stings, and we have all gotten it from people we don't know,
right.
Behind the guys. But
everybody has muscles behind a keyboard.
Yeah, but I've gotten it directly even from the beginning of camp. When we were opening camps, I've gotten it from people I know, that has work with me on a daily basis, and have taken one look and said well, I don't care about all the 99%. The fact that you did this, that cuts me to the core. Why do you hate children? I've had people in our community ask me that. I've had people in the community say, why do you want our children to die? This has come directly to me from people in this community. And yeah, that cuts, right? Because it's one thing for, Joe out in Idaho, right? Who's, sitting around just typing things. It's another thing for people that we know and work. And so if there's one thing that I wish that people would understand about our motivation for doing this toolkit is to just allow us to start talking about how we have normal interactions for us and for our children. And that is such an important thing that we in our medical world need to not be lashing at each other on Twitter and social media and behind each other's backs, but just call us up and have a conversation like we do when we're caring for super sick children. And that's the thing that's been lost, and lost significantly in the last, at least in the last year and a half at this point. And our hope for this is to say, we knew that we were going to get a little bit of backlash, and my open invitation to any of your listeners and any of my colleagues out there that are listening that disagree is we can have normal civil conversations about this and find that we're probably more in agreement than we realize.
You guys, why don't we close on this? 2 more and we'll close. Do you have any regrets now with the benefit of hindsight of being involved with the project? Or
Absolutely not.
co-authoring the toolkit?
No. No. I will die on this hill. I feel that strongly about it. I see the effects in the children that I take care of. I am, like Jeff, I am a camp doctor. I was, last summer, the summer camp where my daughter goes had a more normal session. There were about 85% of the kids that are girls that are normally there. This should have been, and it was for the most part, but a really joyous, happy experience. There were a number of younger girls who were very anxious and apprehensive about being around other people because they'd been out of school, they'd been masked, they'd been distanced, they'd only been with their parents. So it really took them a while to warm up to being in a group and interacting and sitting shoulder to shoulder at the mess hall table. And in the older girls, it was clear that they had spent the majority of their time volleying anonymously on social media, and they also did not know how to interact on in person, face to face, and how to say things. Things land differently when you're saying to someone's face rather than when you're doing it anonymously
social media, with the phone.
On social media.
Yeah.
And so is this a study? Is it validated? No. This is just my own personal experience and my own personal observations. But kids thrive in normalcy and in their routines and knowing what every day is going to look like. And part of that is being able to be with their friends and to not worry about being within 3 feet and to be able to hear them and to see their facial expressions when they talk and to be playing on their sports teams and to be playing in band and doing all of their extracurriculars and having sleepovers and all of those things. And we have taken a lot of that away from our children over the past 22 months. And it breaks my heart, and so I am doing whatever I can to advocate for our children to get their lives back, because certainly the adults, for the most part, have gotten their lives back. So it's time to bring them along and prioritize them.
I have absolutely no regrets. Jerry, you said that this was going to go viral, so maybe this is my one regret. You said it was going to go viral, I didn't believe you, and I'm realizing that you were very true, and accurate in that with how many people that are reaching out to me from across the country. I have a patient of mine, and maybe she's even, or a parent of mine, maybe even listening, that are in the Central Virginia area that I would classify as my most concerned parent about COVID, period. And for the last 22 months, I have probably had weekly conversations with this person, talking to them about risks for their kid. And their kid has significant heart disease that is doing very well with. And talking to about that and walking them through with the rest of their family. And she has pulled her kids out of school on multiple occasions, pulled herself out of work on multiple occasions, was first in line to get everybody vaccinated. She called me almost, had sent me an email, and then we had a conversation almost in tears because someone had sent the toolkit to her. And said on the same day that this landed, her son, who is almost 5, came home from school and said, "I don't want to go to school anymore because I don't like getting sent home, and I'm worried I'm going to get sick." And she was said, I looked at this and I realized, as my most panic parent, that I do need to start wrapping my head around how we return my child to normal, and how we return him to normal, because I am creating a situation that I know he is not as nearly as at risk for COVID, and now he is at risk for me having him hate life and being afraid to leave the home. And that is going to cause more long-standing damage. And, with all the bad stuff we've gotten so much more good stuff, just so much more outreach and good stuff. But I'm going to remember that situation from yesterday for the rest of my life, because that's why we did it.
Got a timely piece of news that literally just broke moments ago during the show. And this is, in part, the influence of the toolkit. This is breaking news from Fluvanna County School System. The school board voted moments ago to go mask optional and to remove contact tracing by a 3-2 vote. This goes into effect immediately in Fluvanna County Public Schools, and the toolkit was referenced in the decision making. Fluvanna County Public Schools, parents now have the choice whether their kids wear masks or not in schools. And Fluvanna now joins Orange, Green, and Augusta in early February with this, along with the Covenant School and Charlottesville Catholic School that are making masks the choice of parents. So that's some breaking news here on the I Love CVille Show. Closing thoughts, as long as you guys want, show is yours.
I would just like to reiterate that the point of the toolkit is to give people the data so they can make a decision. We are certainly, while the studies on masking are in there, we want people to be able to make their own individual choice. And when we are talking to schools, we would like to normalize both not wearing a mask and wearing a mask. We know that there are going to be kids who, for health reasons or comfort reasons, are going to want to continue to mask, and that is fantastic.
Yeah, you guys
and
aren't
they should.
anti-mask.
No,
Yeah.
no. But this is very much a personal decision. But we want it to be a personal decision based on actual data and what the risks are to the children and to their teachers. Right? Realizing that we're not just talking about the kids, we're talking about teachers also, to which I would say that being vaccinated and boosted is your best protection. And if the teachers want to continue to mask, by all means, they should, right? Like, we should take all stigmatization off of this. But let's give families a choice. Let's give them the information that they need, and then let them make that choice.
I frequently tell patients of mine when we are dealt with decision making and in our treatment courses or whatnot, that I say, it's hard for me to offer an opinion when I don't have your worldview and I'm not sitting in your shoes. And I say I win. Win is a weird word, but I win when you've made a decision and feel comfortable decision based on the levels of evidence that I can provide you. I feel very equally about this. I think there's probably a lot of people that think that, Liza and I are going to high-five each other that Fluvanna said this. That we are, without a doubt, not going to do that, right? We win when communities and schools feel that they're making decision based on evidence that we have presented that fits right for their school and advocates for the normalcy of children. Right? And we know that some people that's going to be today, some people that's going to be next week, some people that's going to be next month. And we want to normalize the decisions about this and understand that we feel good if we can provide information that helps people wrap their head around something in a clear way and make a decision that's right for them.
Thank you, guys.
Thank
Seriously.
you.
Thank you very much.
Yeah, absolutely. Thank you.
Very grateful for the time. The website, for those that are asking, is urgencyofnormal.com. You can download the toolkit if you're on a desktop computer in the top right corner of the website. Very easy to navigate. 22, 23, 24 slides that are easily digestible, very approachable. For those that are asking, yes, it's a 3-2 vote. Fluvanna County Schools have now made masking the choice of parents, and the toolkit referenced in the school board vote. Dr. Holland, our guest, Dr. Vergales, our guest. For those that want to watch the interview in totality, we will archive it on ilovecville.com, and we'll archive it on every single social media platform humanly possible. I'm sorry I cannot get to all these questions. I just don't have the time. And for those that are asking, and I understand you want both sides of it, Dr. Wolfe will join us in tomorrow's program to offer her perspective as a pediatrician who is very much pro-mask mandate. And we do that to offer both sides of the story so you can make the decision. My name is Jerry Miller for Judah Wickower. This is the I Love CVille Show. We will see you tomorrow at 12:30. Take care.